Okay, I'm Elizabeth Coe. I'm the CEO of National Association of Contact Centres. Um, and one of the things that it's important to know, brief introduction to NAC. NAC is a charity dedicated to supporting children and families. We've been going since 1991. And we have 300 contact centres across the UK, Northern Ireland and the Channel Islands and the Isle of Man, run by a network of over 4,000 volunteers and 2,000 paid staff. NAC ensures that all member centres meet national standards through a rigorous accreditation process, which includes regular assessment and compliance checks. They also provide training, support and helplines for advice and guidance for parents, professionals and the centres themselves. The standards, the centres have to work to these approved standards, and it's important to note that all centres are not accredited. There are some unaccredited centres there, so it's really important to make sure that if you're using a contact centre that it is accredited. There are two types of contact centres. There are supported, which is a safe environment with minimal intervention. They do not take cases where risk is an issue, or if there is any risk, it has to be very, very low risk. There are supervised contact centres which have a high level of supervision and reporting to the court when requested. These are largely run by social workers or equivalents, and are a much more professional body and will be expected, as I say, to do reports for courts if requested. We have an additional service which is called Community Contact Services, and we set this up, and we have about 24 now people doing this for areas where it's a rural community. It wouldn't be good enough to sustain a full contact centre, but that we feel that children in those areas really do deserve to have an opportunity to have contact with the parent they don't live with. And this is a paid for service, but it is a service for these children. There are also handover facilities which exchange children between parents and carers. We don't expect contact centres to be long-term arrangements. They provide a stepping stone to sustain relationships with people they no longer live with, but whilst the parents are getting over their initial difficulties in terms of communication. We try to ensure that relationships are safe and enjoyable for the children. We've talked about that. We have national standards, as I've already said, that centres have to apply to make sure they meet. There is accreditation, and that is an assessor goes every 3 years and does a very, very detailed investigation of the various policies, procedures, making sure they have DBS checks, insurance for their buildings, that the buildings are safe, etc. We can remove membership if a member is not complying with national standards, or we have a complaint that raises concerns to us. We can remove that membership, or we can lapse it until they sort out whatever it is that we have problems with. It may be that we've gone in and there's no DBS check on a member of staff. Then we have to say to the centre, you can no longer operate until that's sorted. So we try to ensure that all children are kept safe at all times. Statistically, these are where all our supported centres are, and as you can see, in the rural areas, northeast, northwest, there are gaps, and that's why we have the community contact service. Those are where all the supervised centres are. The court, when they make a contact centre order, the parents have to do referral forms. There's an assessment of whether there's any risks, in which case they will be referred to a supervised centre. If not, the parent will be asked in for a pre-visit, and they will be asked to bring the children with them. They will be given at the pre-visit a parenting plan, and the parenting, they will be told that at the point of 3 months there will be a review, and the parents will be expected to think about how they're going to take things forward in the future, because we try to limit time at the centre to 6 months, unless there are reasons like mental health or drug and alcohol abuse where this can't happen for the time being. So we try to limit it though. We have a judicial protocol with the court. The protocol is very, very clear about when to use a contact centre and when not, and that that accredited centres only should be used. And if anybody wants to see where their nearest contact centre is, on the NACC website there is a yellow box with Find a Centre. If you click on that yellow box, it will have a drop down and it will ask you for a postcode or a town, and if you click on that, it will tell you what centres are in that area and what they provide, and also the costs associated with it. So the judicial protocol has been going for quite some time, recently reviewed by the President of the Family Division, Sir Andrew McFarlane, and it is what the courts have to abide by. There are also some draft orders that go alongside that to help the court.